Let's talk sports medicine, one of my favorite parts during the week. It's to bring in a guy who's been part of the morning show here on WAKR for over 30 years. My good friend, Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Dr. Joe, good morning. What is on your list today?
Hey, Ray, could we, we're fully into fall now and fall sports and stuff. Can we get the endurance athletes in on the fun? Can we get the cross-country runners, the soccer players, basketball, where you're running all the time? You don't happen to know any cross-country runners, do you?
I know a couple, that are really enjoying it. Indeed, yes.
That's great. And I know they're coming down the stretch of the season. But one of people I saw in the last couple of weeks was a runner, and she was telling me, gosh, so many people on our team and other things are struggling with this this iron deficiency. And could you explain that a little bit? So many runners and other endurance athletes, soccer players, basketball players who run all the time get this too. And I wanted to talk about that briefly this morning. And the symptoms for a lot of these kids can be very different. And these symptoms don't definitively pigeonhole them as having iron deficiency, but typically, of course, they're going to be fatigued. They're going to be, one of the things, drop in performance. A lot of times they notice, hey, my times are going down. They're going in a bad direction. They chart what their times are in these sports. Another common complaint is they just say dead legs. I get, middle of the race, later in the race, I have dead legs, weakness. Their skin may be pale. People like parents and trainers might notice that they're a little bit pale. Another thing is they get shortness of breath, and that's kind of sometimes frightening to athletes when they're short of breath. They sometimes get lightheaded, and some even describe it as headache-type symptoms. That's kind of the typical profile of iron deficiency, but that doesn't mean with all of those symptoms or any of those symptoms that you definitively have iron deficiency. This needs to be looked at because you can go down the wrong direction in a workup and be treating somebody exactly the wrong way. So starting out with, a lot of these kids discuss and should discuss this with their athletic trainers. The trainers are such the key. I talk about that all the time in the schools. Talk with your athletic trainer and see where they're at. They may recommend some discussion with somebody like a sports nutritionist. One of the real good things we've added at our Akron Children's Sports Medicine Center is we have a great sports nutritionist, Abby Granger, who helps a lot of our athletes, and our whole team understands nutrition pretty well. But sometimes these people need a sports performance evaluation. And we also added a great pediatrician to our team who is a specialist in sports performance evaluation by the name of Dr. Michelle Levitt. And Michelle does the workup on this. So if these kids are in season and they're having these symptoms and their times are dropping and they don't have long before this season's going to be over, they want to see somebody who's going to figure out what's going on. And I talked to Michelle yesterday, and the workup is still pretty much the same as it was when we started to look for iron deficiency several years ago. We often start out with a blood count. That's important because are these kids anemic? But the misconception is that everybody's anemic, and for a lot of them, they're not truly anemic. They're just iron deficient. But they could also have an infection that could present like this, or they could have thyroid issues. So thyroid studies need to be checked. Dropping vitamin D levels can do so many different things symptom-wise. We need to check a vitamin D. We check a test called a CRP for inflammation. But the big tests are the iron studies, and the serum ferritin really tells us what the stores are. And if your stores are low, you're going to be tired. You're going to get these symptoms. You're going to need some replacement. And, of course, the best replacement is diet. Diet's the best way to do this. But if we don't have much time and we need to get those iron stores up, a lot of times these performance people like Dr. Levitt will actually put them on an iron replacement therapy. And they know exactly what therapy and what can get that iron up pretty quickly and how often it's these kids to see if the iron's going in the right direction. So I really recommend, if we're getting into the season, we've worked hard, and we start getting some of these symptoms I talked about earlier, I really recommend getting in to sports medicine, your sports medicine specialist for a workup of this. And so the real three take-home points I want to make, and these are where some mistakes have been made through the years that I've seen doing this for a long time. Number one is iron deficiency doesn't always equal anemia. So a lot of people check the blood counts. They say you're not anemic. They say, get back out there and run some more. This isn't iron deficiency. 75% of the time, kids will not have anemia, but they can have iron deficiency. So that's number one. Number two, this is not only a female athlete thing, and this has really increased in my day. And I remember us starting to, could males get iron deficiency? And certainly, studies I looked at last night, as high as 15% of these are males in these clinics that have iron deficiency. And number three, you need to rule out other causes, because certainly when people are fatigued and have some of these symptoms I talked about, this could be coming from many other sources. And that's why a good workup that I talked about earlier with some testing that looks at things like thyroid and inflammation and stuff like that, so that we make sure we don't go down the wrong pathway and that we rule out other causes. But remember, the best treatment for iron deficiency is prevention. So in the off season, making sure your diet is well balanced and has a lot of iron in it. That's really the key to the issue of iron deficiency.
That's really good insight. Joe, can I ask you this? And I hate to go down the nutritionist road, but what are some foods that would be good with iron to get into the diets?
Yeah, the green leafy vegetables are really high on the list of things, and I think that's a good direction to start. And I think that again, speaking with your trainer, that they will give you. There are diets specifically high in iron that they can help you with, and the nutritionist well. And so I think that's really a good question and really a good, very important point of, again, prevention rather than treatment, which is really what we like the most.
Yeah, Joe, great insight there. I know my twins who have been running a lot of cross country the last week or so, they said, gosh, Dad, we feel a little bit weak. Times are down. I didn't think about the iron deficiency thing. I'm going to look into that, but I'm sure I'm not the only parent that heard your words of wisdom there and say, okay, let's put that to work. Really good job this morning, Joe.
Yeah, just like our overuse kids who by this time of year, it could be as high as 20, 25, 30% of them are starting to hit that where they're heading downhill a little bit. Same thing with iron deficiency. It could be as high as a quarter to a half of our endurance athletes. So it's a good thing to check, and if you catch it early enough, diet can be the only thing that you need to do to get it turned around.
Fabulous. Joe, great stuff this morning, my friend. Always appreciate the time. We'll do it again next week.
Okay, Ray. Sounds good. Talk to you then.
You got it. Dr. Joe Congini, Sports Medicine Center, Outcome Children's Hospital. Again, a valuable part of this show for 30 years in the mornings here on WAKR.